Hello everyone, I am Dr. Puru Dhawan and today I am going to discuss with you about some medicines that are harmful for the kidney patients. Medicines are consumed by everyone for treating different health issues. But due to lack of awareness and knowledge, sometimes people consume medicines that are harmful for their kidneys. And such drugs can slowly and gradually result in kidney failure. So let's discuss these harmful medicines one by one in detail. But NSAIDs are nephrotoxic, which means they are too risky for a kidney patient. It is seen in many cases that being unaware of harms of NSAIDs, kidney patients take painkillers for their back pain without consulting a doctor. This put an extra burden on patient's kidney. The filtration ability becomes weaker and the patient's creatinine level starts to rise even more than before. Apart from this, consuming too many painkillers can create kidney issue in a healthy person also. So one should try to avoid NSAIDs as much as possible. Moving ahead, now comes the another category of medicines which are harmful for the kidneys, and that are the antibiotics, especially ending with the word mycin. For example, tobramycin, gentamicin, azithromycin. Antibiotics are taken to treat different type of infection like common cold and flu. But people make a big mistake by consuming them without any proper prescription of the doctor. This habit can silently damage the kidney over time, as antibiotic might cause inflammation, especially when taken in high dosage or for a longer period of time. Now let's discuss the third category of the drugs harmful for the kidneys patient, and that are antacids. These medicines are used to treat gastric acidity, a common health issue nowadays. But the overdosage of these medicines can affect magnesium and calcium level in the body, which further puts stress on the kidneys. So instead of relying on the antacids, one can try to prevent acidity through some important following steps. First, increase the fiber intake in your daily diet. For this, you can add fruits, vegetables, and whole grain in your diet. Second, reduce intake of fried and oily foods and increase the frequency of the meal intake, but avoid the overeating at one time. These steps will help to reduce acidity naturally without affecting the kidneys. Now we have covered three categories of medicines which are harmful for the kidney patients. And even if your kidney are working well, try to consume these medicine as little as possible. I hope this much is clear to you. Now moving further, there are some medical tests also that are harmful for the kidney patients. The first one is the DTPA Renal Scan. It is used to check the GFR of a kidney patient. It is done by injecting an ink into the body which is made up of radioactive iodine, a nephrotoxic substance, which means serious issue like kidney failure can occur. That's why patients should go for DTP renal scan only if necessary. Moving further, the other harmful tests are angioplasty and angiography. These tests are used to check blockage in the heart. In both of these tests, a contrast ink is injected in the body, and this dye is harmful for the kidneys. So if your doctor advises you to undergo such tests, always make sure to inform them about your kidney condition. Even if you are a healthy person, try to avoid such tests. So now I have discussed all the medicine and tests which are harmful for a kidney patient. But always remember, with proper awareness and timely advice, kidney damage can be avoided. I hope all things are clear to you. See you all in the next video. Till then, take care, bye-bye and namaste.